member of the community of people who use drugs, it's always interesting to follow up and keep on top of information and research that relates to people who use drugs in South Africa. So that was one of the reasons why I was drawn to this article. Fast forward 15 plus years, there is harm reduction information, there's needles and syringes, there's OST, and gradually in South Africa, very gradually, we're getting to a space where we want to educate and encourage people that it's okay to say you use drugs, because if you can say you use drugs and be open about it, you may be more comfortable and open to access other services.
There's a couple of things that we need to always put in context, and that is the journey that we've come from to understand where we are now and where we want to head to. If we don't understand where we've come from, we will have no hope of navigating the now. We have to continue the connections, but we always have to be aware of what our motivations are behind the work we do or the connections we make. And if we keep community at the center, and if we work in a coordinated way to make sure that things like decriminalization and or legalization and furthering the health of those that use drugs and people that inject drugs, if we do that, we're going to get somewhere moving forward.
I heard Claire Kennedy talking about a situation in Vancouver where the fentanyl levels in the illicit drug supply have been directly connected to the increase in the mortality rate, and they've had to call a public health emergency. And research has proven that the levels of fentanyl in the illicit drug supply directly correlates to the increase in the mortality rate. So they found that if the public knows, they're likely to be more careful and not inject alone. And for me, working in regional Australia, it's just relevant because we haven't got fentanyl in our drug supply yet, but it's likely to come.
Being from Costa Rica, from Latin America, and there's a lot of stigma. And that's also one of the key components that I've really been enjoying, and learning a lot in this conference. Structural stigma, institutional stigma, even self-stigma. To see the way forward in the global community to address stigma, to address criminalizations, to change these perspectives on how the people who use drugs get attended or get addressed by governments and mainly health institutions, I think it's also a key component for the discussion in our region.
Someone said that harm reduction is driven by care, and that was a foreign concept to me, even though I've worked in the sector for years. To me, harm reduction has always, in my mind, been driven by the political umbrella of harm minimisation. That made me think about the future and how we can impact on elimination and moving forward into legalisation of drugs. And the community involved in INHSU 2021, they all reflect those feelings, and I think we have a good chance to make a difference and bring those things into fruition in the future.
I suspect from my local perspective that we are going to be in a situation for quite some time where the capacity to respond to hepatitis C is lower than it has been before COVID. And the reason for that is that regardless of what occurs vaccination-wise or COVID case-wise, I think that health services are going to be preoccupied with COVID for quite some time, and that will just naturally take away resources from other communicable diseases, particularly Hep C, because that's what we're thinking about here. I'm not sure how it will impact other things. On the other hand, in the long term, it may well be that, as I said, the infrastructure that has been put in place to manage COVID, the lessons that we've learned, prevention, testing and treatment actually work.
I was really keen to hear from Margaret Beezer about her research within the homeless community and a hostel within Boston. And part of the reason that I was really interested in that is because I'm doing my MSc in public health. The amount of resources that have gone into hepatitis C elimination, if we don't if we really don't invest in adequate and gold standard needle provision, then we're not going to keep our status, and we'll have to do all this again in 5, 10, 15 years. And more importantly, people are going to die in that time. The key takeaway from Maggie's research for me is that we really need to be vigilant. We really need to make sure we've got robust retesting in order to pick up reinfections swiftly and retreat. Otherwise, we're not going to maintain microelimination, let alone world elimination.
What I really got was this harm reduction being invisibilized by treatment. Like, that really stood out for me, and how the current policy actually doesn't allow people diagnosed with Hep C and treated for Hep C, and not actually looking at the totality of that person and the fact that they're, drug users. When we medicalize something and put it to a diagnosis, then we really limit what we have to do for that person. And, that's so disingenuous and so harmful.
One of the unique selling points for me around INHSU is the fact that it brings the entire range of people that are on this journey together. And I think why this is important is because no one discipline is going to reach Hep C elimination and maintain it, more importantly, on their own.
INHSU 2021 was about so much more than just hepatitis. It really embodied the whole health and hepatitis in substance users. It's not just one thing. It's not just about getting tested and treated. We're the ones that can help empower people who use drugs to start to get involved in being the owner and having agency within their own life.